get started now. So for those of you in line, you'll just have to listen. Well, I hope everyone's doing well. I feel like I haven't been here in a while. I just did a hike in the Adirondacks, so if you see me wobbling and groaning when I move, that's why. So we have an MVP announcement and then a couple other quick announcements. I'll start with the announcements. We had a fire alarm go off, I guess earlier this week. I don't know, I wasn't here. And the fire doors automatically close when that alarm goes off. So just be aware. I think Matt goes through every year what you should do. You should stay in your apartment. You touch a door, feel if it's warm. You're always safer because of the fire doors. But if you're walking the halls, those doors close. Don't be intimidated by them. It can be a little scary when you're standing in a hallway and they close in front of you and behind you and you feel like you're locked in. You can still go through those doors to get to wherever you need to be safe. But just be aware that it doesn't mean you're locked in. So just keep that in mind and use your best judgment. I want to give you a quick update on our progress with our expansion project. We did have a conservation committee meeting, which is attended by our developers and some Fox Run staff as well, and it went very well. They approved our landscape plan, so that's good news. This planning board meeting that we've been trying to get on for such a long time, we are on next Thursday's agenda. So yes, I know, right? Actually, while I was hiking, the town supervisor called my cell phone and he wanted to give me an update and to tell me we're on the planning board meeting. But then he started telling me that it's going to take 3 or 4 meetings for us to get approved, which I'm going to apply some political pressure. I'm going to reach out to the mayor, who is a Fox Run friend, and really kind of work the system. That's the only reason we're on this agenda, is because we've been able to use back channels a little bit. So you just got to work hard, I guess, just to get there. And I believe that's it for my announcements. Did I miss anything? Okay, MVP. So our most valuable player. This is for the month of June, and it's a face you may not see very often because it's somebody in our health center, and it's somebody that works overnights. So I'm going to ask Polly Yates to come up. So Polly worked, I asked her, so I went in the back room, I said, did you work overnight? You're staying for this? She's like, I would never do that. No, she didn't say that. But she did come in specially, and this is somebody who works overnight. So I'll read this, and then, so this nomination form came from our administrator, Allie, who's in the back of the room. And it says, Polly has been our RN overnight supervisor for just shy of 2 years. In that time frame, Polly has become an absolute asset to our skilled nursing community. She's a hard worker, team player, and one of the most compassionate nurses. Sorry about that. I've had the pleasure of working with. Her colleagues, don't laugh at me, who's that? Her colleagues enjoy her presence and her work ethic, admiring how she always feels joy and gratitude no matter what the situation is at work or what conflict must be handled. Residents and families absolutely love her. I always hear amazing feedback about her dedication and grace when working overnights, especially when it comes to the end-of-life care. Polly has the ability to give people peace and comfort in the most vulnerable times, something that stays with them long after her shift ends. Fox Run is so lucky to have Polly. And I'd like to add to that and just say that I also hear, I receive feedback as well, and I hear a lot of stories. One in particular was one of our board members has a family member up in skilled nursing, and they went through an event, kind of a scary event. And when you go through something like that, you really need comfort. You really need to know that the team around you has everything covered. And this particular board member just was gushing all about Polly. She said, you have to say something about Polly, we have to give her something. So to get that kind of feedback for somebody who's kind of a watchful eye upstairs in skilled nursing really says a lot, because she has high standards, and Polly exceeded those standards. So Polly, thank you for everything you do.
This is interesting. I've never spoken with a microphone before, so forgive me.
You'll never put it down. That's how it happens to me.
Well, good morning, everyone. My name's Polly. I'm an RN. I work over at the health center up on the second floor. I do see a couple of familiar faces, so I think a couple of you have been over there for tune-ups, but I always say I hope I don't see you, but if I do, know that we're there to take care of you, and I can't thank you enough, all those kind words, and taking care of people is a real passion of mine, and I like to lead by example, and I think the crew over there is just phenomenal. It's something people don't like to think about or plan for, but we gotcha. So if you need us, we're there, but thank you, it's an honor, and I really
So we just gave her a gas card, and she lives 5 minutes away, so perfect. I thought you were telling me you have an electric car, so. Aren't we blessed to have Polly? Wow, that was really nice. Okay, so any resident announcements?
I just want to thank everybody for bringing their mug to coffee hour. We really appreciate it. James Runner has extra ones back there. Just to get yours. He takes them home, washes them, and brings them back. So we want to use as few paper cups as we can. Thank you.
And that was a thank you for using the Bring Your Coffee mugs. Thank you, Green Committee, for keep bringing this back and keeping it going. Ilona.
Good morning. I'd like to just thank everybody for the tabs that you contribute in the trash room. I took the tabs over 2 weeks ago, a huge bag full, and I asked the question. I said, now really tell me, where does the money from these go? And she said to me, it goes to all of the Shriners, kids and families. They ship, if they have to go to Philadelphia for surgery, they pay the whole thing. So it's all kids, if they have to go to a burn treatment center, anything, but it's used for all of the kids here in our area. So I personally want to thank everybody. Please continue, and for new people, the tab is in the trash room. It's a container on the left, downstairs. And if you want to collect them in a little bag and then put them in maybe there, or you want to put it in 120 mine, I appreciate it, we appreciate it, and the Shriners appreciate it. So thank you all very much.
Thank you, Ilona. Beth?
Allison, do we have an update on Allison?
Do we have an update on Allison? She's doing great, that's all we know, yes. She chimes in every once in a while. We send an email where it gets rejected because she hasn't turned off yet. She tends to respond, so as you might imagine, I hear she's doing great.
Thank you.
Yes, Marja?
Just a reminder, Yarn and Thread does not meet in June, July, or August, but we hope to see you in September. Any kind of needlework you do, you're welcome to come.
So Yarn and Thread is on summer vacation, and then they'll be back to make us something warm for the winter season. Anyone else? Yes?
I'm sure everyone is missing Sue Bolter today, and I will report she's getting a hip replacement, and I bet you she'd love a card.
Oh, that's very nice. So, anyone thinking of Sue? She'd love a card. Michelle? She wants to come up and use the mic. We all think we have loud voices, and then until we start talking, nobody can hear us.
Good morning, this will be nice and quick. I just wanted to thank everybody who was here last night for Audrey Gleason's art opening. It was phenomenal. She really knocked all of our socks off. It was a pretty special evening. For those of you who weren't here, her very first job that she was paid to be a fashion illustrator, she was 21 years old. And last night, at the tender age of 85, was her very first art opening. So really pretty cool. And I asked her if she was coming this morning to coffee hour so we could recognize her. And she said no, that we wore her out last night. But if you haven't had the opportunity to go into the gallery, you'll see she's got a lot of oil paintings. And for 7 years, she had oil paintings in the Albright Knox Art Gallery. And then also around the corner, all of the small short stories, those are all true. Everything that has happened to her, and they're very funny, so take the time to read them. And then lastly, I wanted to welcome Sue Norton, a brand new resident. She's sitting in the back. Sue, if you want to wave. She's in 254. And Celine Crabb, do you want to wave? And Bonnie Caruso. Welcome, welcome, welcome.
Thank you, Michelle. Wow, what talent we have at Fox Run. It's just never ceases to amaze me. Alona.
I only have one last phrase.
Okay.
Just to make everybody aware, we still have a very active prayer chain. If anybody needs prayer, just zip me. I'm in the directory under Klein. And we pray. We don't have to know last names. We don't have to know exactly what's going on, but you have a group of people here that will pray. So if you're interested at all, please don't hesitate. And I don't care if you're a heathen, we will pray for you. Thank you.
We can all use a prayer, no matter what. Thank you, Alona. Okay, so, one more. Lois?
Was Dale introduced? Dale?
Yeah,
Yes.
Who's Dale? Who's Dale?
All right, so I'm very excited about our speakers this morning. We're going to learn a little bit about our therapy department. So I'd like to introduce Tracy, who we all know, and Jessica, who I'm sure you all remember from our satellite clinic during our pandemic. So Tracy and Jessica.
Good morning, everyone. Good morning. Thank you for having us back. We haven't been here in probably maybe 3 or 4 years, pre-pandemic since we've been here. So thank you for having us back. I have just a little bit of a presentation. Some of it may be dry. I apologize in advance. We're going to be talking a little bit about insurance and physician signatures, so that is no fun. But I want to at least get that information out to all of you. And Jessica has come along too, and will answer any questions that we may have, that you may have at the end. So first of all, I wanted to talk about the diversity of our program. We offer physical therapy, occupational therapy, and speech-language pathology services. Physical therapy is perhaps the therapy that most of you are familiar with. When you hurt your back, you come to physical therapy. If your rotator cuff or shoulder isn't working well, you come to physical therapy. If you have pain, you come to physical therapy. So the goal of physical therapy is to increase your strength, increase your muscles' abilities, increase your range of motion, your flexibility, increase your endurance, your activity tolerance, all in hopes of increasing your function. We also offer occupational therapy, and many people say, I don't want to go to occupational therapy, I don't work anymore, I don't have an occupation. And mostly that is our men that say that to us. It's true, I don't want to do this, what's the point of this? But anyways, joking aside, occupational therapy is more about our ADLs, our activities of daily living. Our therapists with occupational therapy help you with dressing, grooming, bathing, toileting. They can offer adaptive equipment. We brought some adaptive equipment. Jess, would you mind just grabbing some of that, please? So our occupational therapists will work with this adaptive equipment, which will help make your activities of daily living easier. What do we have first here? All right, so this, what Jess is holding up, is a long-handled shoe horn. So if we can't bend over to get our shoes on, that's a very long-handled shoe horn. Can you all see in the back? Okay, another piece of adaptive equipment that our occupational therapists may work with you with is, or physical therapy may even use this too, is a leg lifter. If your leg is weak and you have a hard time swinging your leg up into bed, this will hook on the end and help swing your leg and lift up onto the bed. I'm sorry, sometimes I'm not talking into the mic. Can you all hear me okay? Okay. Another piece that she has is a reacher. I think most of us are familiar with the reacher. When you drop something, you don't have to bend over. You can use the reacher
Hold on it
to get it.
Hold it better, girl.
We can pass them around too if you want to look at them. And then the final one is kind of unique. It's a dressing stick. So it can help you get dressed with your shirts, with your pants. It provides extra hooks. We also have button pullers where it's a little metal hook that can help pull a button through the hole. Because occupational therapists also work with fine motor coordination. The old school way, or a lot of other facilities, talk about physical therapy being the upper half of the body, occupational therapy being the upper half, physical therapy being the lower half. We don't like to do that. You're a whole person. We do not draw a line down the middle of you and say, this therapy work here, this therapy work there. We work as a group, so that's why Jessica, as an outpatient therapist, sees a lot of shoulders, even though it's the upper body, and occupational therapists tend to like the upper body to work there. Physical therapists are better trained for shoulders in certain areas. So we work as a team with PT and OT. We also work as a team with speech-language pathology, and this is very interesting, what speech-language pathologists do. And I like to think of it in terms of 3 separate areas. First and foremost, they can work with your cognition, your memory, your thought process. OT does a little bit of that too. There's a little bit of an overlap, but with speech, they may ask you to recall certain events. They may teach you certain strategies. So if your mind is not working as well as we want it to, speech-language pathologists may work in that regard. They may also work with speech itself. So someone that may have had a stroke and has a hard time forming words, or their voice is very low, maybe with Parkinson's, they will work on the muscles and help you actually speak. And then finally, they'll work with swallowing. I like to move around a little, I'm sorry, keep everybody going here. With swallowing, a speech-language pathologist will assess your ability to swallow, and they may give you an altered diet. So liquids that we drink normally are thin. A speech-language pathologist may recommend a liquid that has a thicker consistency, like nectar thick, or honey thick, or even pudding thick, which, as you can imagine, is very thick and not very liquidy. The reason that liquids are thickened is as someone ages or as someone weakens, our swallow may not be as strong, and we may need the liquid to be a little thicker, which slows it down, which allows your body to swallow it properly. It doesn't then run into your lungs where we would worry about coughing, choking, pneumonia. Same thing with liquids, as the speech-language pathologist will look at solids. They may have it a regular consistency solid, or it may be mechanical soft where it's easier to chew, or it may be puree where it's even easier to chew. You may not have good fitting dentures, so you may have to have an altered consistency so you can still eat and drink, get in your nutrition, but in a safe way. Conditions that we treat or address: post-surgical conditions, a knee replacement, a hip replacement, a shoulder replacement, pain, back pain, neck pain, arthritis, osteoarthritis, rheumatoid arthritis, any generalized weakness. Jess sees a lot of falls, a lot of balance, generalized weakness, and teaching somebody how to use a walker, how to use a cane. So we see a lot of conditions in our clinic. Any questions so far? Yes, Bobby.
Who is the speech-language pathologist?
Ooh, I'm glad you asked. We're going to get to that. Bobby asked who is the speech-language pathologist. Her name is Ellen. We don't have a picture of Ellen, but I can talk a little bit about Ellen coming up soon. Ellen is here about 2 days a week. Yes?
occupational therapy, why, we're not working anymore. Call it something else like resident therapy.
It's what it's known, the question is, can we call it something else? It's, occupational therapy is what's known in the world, in the country, everywhere around. But it is funny, the word is confusing, because again, people think they're going for work, re-education. Yes?
How do you get into these programs?
Oh, perfect, that's coming too. The question was, how do you get into the program? So that's coming too, I'll show you. We have inpatient and outpatient. Michelle was nice enough to give us some pictures. I want to thank Gina, our physical therapist assistant, for helping set up the PowerPoint. She snuck that in there. I don't necessarily like pictures of myself. But I think Elizabeth looks happy. I don't know if she's here today.
That's not you.
That was me. Thanks. 5 years ago. Thank you. All right, so our staff. Again, I am Tracy. I'm a physical therapist. I have my board certification in geriatric physical therapy. So I'm a board certified clinical specialist in geriatric physical therapy. I have my master's and I'm a graduate of Ithaca College. We have Jill Brady Slomka. She is a physical therapist. She is a graduate of the University of Buffalo. And then of course we have Jessica. She's a physical therapist. She has her doctorate in physical therapy, and she is a graduate of Damon. So I work full-time. Jill is here full-time. If any of you have been in the clinic and hear laughter, it's Jill. Those of you that have come know what I'm talking about. It's Jill. She's a lot of fun. Jessica works part-time and is here 3, sometimes 4 days a week. We have Gina Kinsman. Gina just joined us. She came back. She just had a baby. It seems as though everybody's having baby girls. So she just had a baby girl named Cora. She's a physical therapist assistant. She has a bachelor's from Brockport in exercise science, and then went on to get her physical therapist assistant degree at Villa Maria. And Denise Zona is also a physical therapist assistant from Villa Maria as well. Gina and Denise are both full-time. And then occupational therapy, we have Joanne Keith and Marie Muscatello. Joanne has a degree from Canisius, and Marie has a degree from also University of Buffalo. And they are both part-time, but they are here 1 day a week to overlap, to make sure that we ensure continuity of care so they can discuss the cases that we have. And then Ellen Cannon is our speech language pathologist. She's here about 2 days a week, sometimes 3. She's per diem, so in our field, speech language pathologists are usually not hired full-time or part-time on staff, but she's able to come in. She lives locally in Orchard Park, and she's fantastic. She comes in morning, afternoon, evening, most of the time over a meal because she's working with your swallowing. So she may be in the dining room or in a private setting as well. All right, here's our crew. A little bit about everybody, and Killian showed me the pointer, so this is fun here. So this is Denise. Denise will know where everything is and will run the whole department. Without someone like Denise, we couldn't do what we do. So Denise actually started out, and again, she's our physical therapist assistant as well. She started out in downstairs in assisted living, and then moved upstairs to us. What's very special about Denise is she provides range of motion in ambulation. So she walks with our residents in skilled and gives range of motion exercises, taking the joints through motions for our long-term care residents. Every other organization has abolished that position because it's not a money-making position. There's no revenue generated there. So if you look at other facilities that are for-profit, someone like Denise doesn't exist. So we are so, so lucky to have Denise with us. All right, here is Marie. So Marie is our occupational therapist assistant. Marie again or not assistant, excuse me, occupational therapist. She is part-time. She also works at Father Baker. We tell her that she's cheating on us when she's over there. And she has been a yoga instructor for over 20 years, and she's actually teaching at the senior center here in Orchard Park also. Jess, do you want to talk about yourself? Probably not, right?
It's okay, I can talk.
Okay.
So I've been here for about 5 years, or a little over 5 years, and I mostly see all the outpatient therapists, outpatient patients for physical therapy. So I know a lot of you look familiar.
You have some experience from Virginia.
Yes, so I worked down in Virginia in a very similar setting. It was independent living and assisted living, and there we had a little outpatient clinic. It was, I think it was a janitor's closet initially, and somehow it was turned into a makeshift therapy room, but it worked. So the facilities here are a little bit bigger, a little bit nicer. So, but it's always a pleasure working with everybody.
So when Jessica was first hired, she was sending her resume and was calling my number. And we didn't know where we were with the expansion. We didn't know if we would need another therapist. And Jessica was so persistent, and I'm so thankful that she was, because when we needed to hire someone else, she was our first call. So we're thankful for Jess. All right, and here is Joanne. Joanne is another occupational therapist. So she originally was full-time, and then as she started to slow down, she said, I don't want to say age, that's not what she says, but as she got older, she decided she didn't want to be full-time anymore, but she still wanted to work with all of us. So she is part-time. She also teaches at the Occupational Therapist Assistant Program at ECC. Here is Jill, Jill, physical therapist. Jill has a lot of experience in home care, so it's very nice when we go to discharge a resident home. She's got that insight to plan ahead and think ahead about what the home setting should look like. And Gina, again, our physical therapist assistant. Gina came to us from the hospital setting, also an outpatient setting from Olean when she joined us. Are we hanging in there? This isn't the most exciting. Wait till we get to Medicare regulations. Do you need more coffee? Services that we offer: inpatient, short-term rehab, or rehab to home. So that is where you, as one of our community members, would come to the health center and stay with us overnight and receive physical, occupational, and/or speech therapy with the goal to return home, to improve your independence, to improve your function. We also see our current long-term residents that are in the skilled nursing unit. If they have become weak, if they have fallen, we may see them as well. We are present in the clinic 5 to 6 days a week and some holidays, so we will be here on Saturdays or we will be here on Sundays. Medicare requires that we still provide therapy at least 5 days a week. Even if July 4th is coming up and it's on a weekday, we come in on the weekend before or after to accommodate for that. What to expect with inpatient rehab. So when you come in with us, if you have to, for example, and I don't like to use examples, but if you fall and fracture your hip or your pelvis, you will come to us for rehab. And what you should expect is therapy in the morning and the afternoon, physical therapy, occupational therapy, screens by other therapies like speech if needed. And you are with us in the morning, so you wake up, you have your breakfast. You're with us for a little while. You might have time for a tiny nap before lunch. You have lunch. You might come back to us again. The doctor has to see you in there. The dietitian has to see you in there. At some point, you'll want to shower. You will have to be interviewed by nurses, by social work. So if you come as an inpatient to our rehab, you are very busy and you're tired. You're very tired. Dinner comes around, you have dinner, and then you're pretty tired again by the end of end of the day. He's not here, is he? No. What do you think he's thinking? Look at his face.
I want to know.
I can tell you, but it wouldn't be proper.
So here we are inspecting his meat.
It does.
Okay, for outpatient, we can see you as a member of our community if you are in the independent area as far as the patio homes or the apartments. And we also provide outpatient therapy services to assisted living and memory care. And this is physical, occupational, and speech. So we provide all three of those therapies on an inpatient and outpatient basis. What to expect with outpatient therapy, and Jess, you can chime in at any time, is most likely you'll be seen 2 to 3 days a week. And it could be for a duration of 1 month, 2 months, 3 months. It depends on how you're progressing. It depends on your therapy plan of care. And the process to begin outpatient therapy is always an interesting one here at Foxtrot. So in order to come to outpatient physical therapy, we do need a script or a doctor's order from your physician. Most physicians have a computer-generated program, an electronic medical record, that will say exactly what we need it to say. Physical therapy due to diagnosis, arthritis, and falls. Occupational therapy due to right arm weakness. So we need to have an evaluation order and a diagnosis. Some doctors in the community still are old-fashioned and on paper and like a little pad of paper. And then we have to call them and have that clarified. But that script will come to us from many ways. It will come and just show up on our fax machine. We had no idea it was coming, and there it is. Or it will come via Lori Gercio. If you have a prescription, you can give it to Lori. Lori will notify us. Sometimes you receive the prescription and you walk over to us and tell us you have it, which is perfectly fine. We like to do that too. We have an open door in therapy. But we have to have that prescription before we can begin. And the reason for that is a physician must supervise the plan of care. So one of the questions was, how do we communicate with your physician? After we do your evaluation, it's typed up, which is a very lengthy document, sometimes 5 pages, Jess, or so for some of yours. The physician has to sign off on it, certifying, yes, this is my patient, and yes, I agree with them coming to therapy. So there's constant communication as far as documentation with the physician because it is a requirement. After we get your script, we have to have an insurance verification. So if there's ever a delay and you think, boy, I turned in my script and I haven't heard from therapy, it's because your insurance has to be verified. That goes over to Tabitha, and it used to be Melissa and Robin, and then they give us the amount of your copay if you have one, for example, if you have a deductible to meet. Once we get that information and we're armed with that dollar amount is when we call you to schedule. We will give you intake paperwork. That paperwork talks about your medications, your health history, why you're seeking therapy. The evaluation will occur. We will discuss the plan of care because you and the therapist have to come up with this plan of care that's agreed upon to reach your goals. Again, the physician must sign off on it. And within the first few sessions, you're given a home exercise program, so you have homework to do. Therapy will only take you so far if you come to see us 2 to 3 days a week. You need to perform exercises on your own a couple other days a week. Anything to add, Jess?
I think you're covered.
We're good.
I think so.
Here's Jess and Claudia doing the pulleys, so that's to increase Claudia's arm range of motion. Jess is guiding her. So one thing we do at Foxtrot is it's one-on-one therapy. Again, that is long gone by the wayside because for-profit agencies want to see 3 people an hour. So the therapist gives you an exercise, walks away, goes to another patient, walks away. With us, we are one-on-one. And we spent a lot of time educating and teaching the technique for the exercise.
Why? Why is that you're able to do that?
Because of our culture here, because we are allowed to do that. We want to be sure. So the question is, why are we able to do that one-on-one? The culture, the feeling that we want to give you the best care that we possibly can. That's not to say if you are doing an exercise that we may not say, okay, do 10 more of those and then do something else, because you don't need us hovering over you. But we are fortunate enough to be able to see you and give you all of the attention you need. And honestly, there are times I look around the clinic and I am so proud that at one point we had 3 or 4 patients that were all in their 90s, which is amazing. So these other outpatient clinics may have 20, 30-year-olds, and they're more apt to be able to just be left alone. They may not need as much guidance, whereas our population, all of you, we want to be sure you're doing the exercise correctly. All right, we got to Harriet, right? I haven't seen Harriet either.
Oh, boy.
She's still sleeping.
Harriet with Marie. So as occupational therapist, she's working on some upper extremity coordination, some motor activities while standing. So we're working her dynamic balance and her activity tolerance, her endurance. A few other things. We do refer out as needed. Of course, we want to keep you here with us, but we also know that there are specialized therapists that would better suit your needs, and we would never want to do you a disservice. For example, we send out for vestibular rehab. So if you're dizzy and you've got a vestibular dysfunction in your inner ear, we refer you out to another facility or another outpatient clinic. We refer out for a TMJ, temporal mandibular joint, so the joint here where your jaw joins your skull, that's also highly specialized. We have referred out for lymphedema management, where the lymphatic system, which is responsible for filtering and some circulation, that's specialized massage and wrapping that therapists learn. And we refer out for higher level neuro conditions to, for example, Bennett Rehab just around the corner. If someone, for example, had a stroke 3 years ago and they need certain equipment, they have more specialized equipment. But it's rare that we refer out because, again, we like to keep you with us. All right, the even more boring stuff, costs. Medicare Part B, the wonderful government, CMS, Center for Medicare and Medicaid Services, has put a cap on your annual amount of therapy services that you can receive. So they say, and somewhere along the line history goes, that a comma was put in the incorrect place in Congress. The bill was passed that way, and now we're stuck with a certain aspect of this law. So the comma, they say, was put in between physical and speech therapy. So physical and speech therapy have the same pot of money to draw from. Occupational therapy has their own pot of money to draw from. So the government tells us per calendar year, you have $2,300 to work with for therapy for the entire year. So if you have had something happen where you need therapy early on in the year, and you use that money up, come November, December, that's where we run into problems. Your money's gone, so to speak. So they say $2,300 is a limit, and then they were nice enough to put it up to $3,000 for the next limit. The regulations are that in order to receive therapy, it has to be medically and reasonably necessary. You have to show progress. Medicare will not pay for maintenance therapy. It has to be skilled progression with a therapist. So some folks love to come to therapy everywhere around the country, and after 2 to 3 months, when the plan of care is complete and there's no more progress, Medicare won't pay for that anymore. They won't pay for maintenance for you to continue to come, unfortunately. So that's something to keep in mind, where we would love to keep you forever, but we are bound by Medicare requirements and guidelines. There could be a copay if you have an HMO, like Senior Choice. or any of the Blue Cross Blue Shield or independent health products. And again, we let you know that up front. Co-pays can range from $5 to $40 a session. Some insurance require authorization ahead of time, so that may cause a little bit of a delay in us calling you as well. Although one of the major insurances, Univera, has done away with that this year, thank goodness. Another point that we like to make about us here is our continuity of care. And I always use this example as well, whereas you or your loved one unexpectedly has to go to the hospital and they tell you you need to come to rehab, you know exactly where you're coming. You know the building, you know the room, you know the nurses, you know the social worker, you know the therapist. It removes that anxiety of wondering where you're going. So we like that continuity of care. And us as therapists, we know your prior level of function. We knew you were playing pool last week before this happened. We knew you were at the Fox's Den Thursday night before this happened, so we knew you could walk there. So it gives us a good idea of knowing how you are ahead of time, which helps guide our treatment. We often are asked the best times to visit. If you are in an inpatient setting, if you're staying with us, please come after 2 or 3 if you're visiting a community member, because again, we've got that community member, that patient busy all day. We can also help with equipment. Walkers is our big question, where to order, how to get them. To do a walker and have it paid for by insurance is an extremely long, frustrating process for the doctor, for you. Most people go to Amazon. We're happy to point you in the right direction and show you how to get it off of Amazon, if that's what you choose to do. And another nice thing that we still do here at Fox Run is home visits. We can go to your apartment, your patio home, and we can offer suggestions. A lot of facilities have done away with that as well because of the legalities, the liability of driving to that person's home. We don't have to do that here. We can just walk to your home. We're happy to do it. We can offer suggestions about removing throw rugs, where to put safety bars, where to move this piece of furniture, or we may test you and ask you to show us how you get in and out of your own bed, for example. So we really feel that we can provide that continuity and be right with you if you want us in your home to offer suggestions. All right, so there's us at the end.
Nice, Jess.
There's Jess. So we are here for you, bottom line, at any time. You can call either of our therapy numbers about any questions you may have. We tell all of our patients when you're discharged from any therapy, any questions, please don't hesitate to come and talk to us. Don't hesitate to talk to us in the bistro. Whenever you see us, we are here for you. Jess, do you have anything to add?
I don't think so. I know, you did a nice job covering.
I'm sorry, I realize sometimes I'm talking into this and not. I taught at Genesee Community College and I never had a microphone. It was great.
I have a question.
Project, yes.
I don't know if they can hear me. You were stating before that,
Do you want the mic?
yeah. My voice is going.
That's okay.
You were stating before that when other therapy is needed, you send people out. Correct. When other therapy is needed, like throat and whatever that was. Okay. My question is, do you have to have a certification for every therapy that you can do?
Every specialty.
Every. I want to know why you said this.
So Janice wants to know why we would send out vestibular rehab, for example. There are extensive continuing ed courses that a therapist may choose to focus their career on, and they will learn certain maneuvers. They may tilt you backwards, upside down, put your head a certain way, for example, with that case. Lymphedema management and wrapping and the massage, that is many continuing ed classes to get that certification. So therapists that are certified in those certain areas don't focus on other areas. Whereas we, for example, we just completed our fall certification class. So Jessica, Jill, and I are now certified fall prevention specialists because that's the aspect of therapy that we wanted to pursue a little bit more and have intensive training. Does that answer your question?
Yeah, only because I would not want anybody here to think that you didn't want to work on it.
Oh, no, it's not that we don't want to work on you, but I want to be honest and upfront with you, that there may be a more skilled clinic that specializes solely in that, to receive the best care. But we would never want to chase you away. No. Do you want the microphone too? This is kind of fun.
You do therapy for vertigo.
Oh, so
Oh, yeah.
So that's exactly what we were just talking about, the question about vertigo. That's the vestibular therapy. That is what we refer out for. There used to be a place on Camp Road that people liked, or Bennett. So if you ever have that diagnosis, we can help you find someone that's more certified in that. Yes, would you like the microphone too?
No, I'm pretty loud.
Oh, okay.
You had said, how much time might elapse from the time you get the script from the doctor and you contact us to come for therapy?
So how much time might elapse by the time we get the script from the doctor and
Yeah.
you come to therapy
Yeah.
and begin therapy?
Yeah.
We can do a fast turnaround because if it's an acute condition, we would email, it used to be Melissa, but we would email Tabitha and say, we have to get this particular case going, and then she has to do a lot of background work also, entering her into our system. So it can be within a few days, but what we have found is if there is a delay, we're trying to contact all of you and say, we have your prescription, but we don't have the proper paperwork in place yet, but we have it, we'll call you when we get it. Sometimes it could be a couple days out before you get the call, and then you may be scheduled 2 days later, or you may be scheduled the following week, for example. Yes?
Who makes the determination on the progress you're making while you're in physical therapy? And what you said that the insurance will not pay if you don't make any progress. Who makes that determination?
Okay, so the question is, who makes the determination about progress in therapy? So when someone comes to us for therapy, there are objective tests that are done that are standardized tests, standardized throughout the United States, standardized throughout the world. And we use some of those objective numbers, and we look to see, and we set a goal. For example, I'll just pick something very random and simplistic. There's a test where we want you to sit up and down from a chair so many times in 30 seconds. If you may come to us and can only do it 4 times in 30 seconds from sitting to standing because your muscles are weak. We may set a goal for in a month to have you do it instead of 4 times to 6 times. And then the following month we may set the goal from 6 times to 8 times. So insurance companies can at any time look at your record and they want to see that objective progress. So if the following month, 3 months later, we test you and you're still at that number 8, you haven't progressed further from 8, that's when we start to say, okay, there isn't any more progress shown in that example.
Okay. I have another question. Okay.
Oh, I'll come back. Do you want my card?
Sure.
Oh,
I've only been here since, 5 months or so. And the question about prescriptions, I don't even know who is considered my primary doctor. I'm a VA person. I'm disabled, VA, believe it or not. And I have seen a doctor up there for some things. And I have the mobile medical, whatever that's called. Mobile primary. And I see Serena, and I'm going to see her shortly. Now, can Serena write a prescription?
So Medicare requires the prescription by a physician or a non-physician, which could be a PA, physician assistant, or a licensed nurse practitioner. So it could be an ND, a DO, a PA, an NP. It could be any of these practicing providers. And it doesn't have to be your primary. It could be your orthopedic. It could be your neurologist. It could be your rheumatologist. It doesn't have to be your primary.
Podiatrist?
Podiatrist, yeah. But it does have to be someone that is willing to sign our physical therapy eval that justifies that that you are under their care and willing to continue to see you. We have run into trouble where a doctor has retired and we've never been able to get those evaluations signed. And if that chart is audited, Medicare could take all of that money back. It's no harm to you. Your therapy was still complete, but we didn't meet regulations because that doctor retired. I think we even unfortunately had a doctor suddenly pass away once, where we couldn't get it signed. But it doesn't matter who it is as far as specialty, as long as they are reachable, sign the evaluation, and get it back to us, and still see you. Questions everywhere, yes?
Tracy, if my Medicare refuses to pay any longer, can I do private pay and stay and take more therapy?
Yes. So if your Medicare refuses to pay any longer, there is a private pay option. We also try as much as possible to maximize your benefits. The dollar amount that Medicare allows you per the year is based upon in time. So if you come to us for 45 minutes, you are billed more than if you come to us for 30 minutes. If we know that you're nearing the end of your money, but we still want you to come with us and you still justified, we may drop your sessions down in length, but that will prolong you to be with us. So we have strategies to try and give you the most care that you can have. But when all those strategies run out, there is a private pay option, yes. We also can train and teach family members how to do things too, which could supplement your rehab. Yes?
Okay, this will follow a question. Okay, I've been with a doctor for a long time. Now, how do I, okay, the doctor generally, if you need therapy, he recommends going here or going here, whatever, they have their work. What do I need to say that I have to come or would like to come to Fox Rent, or should I say that?
You certainly can. Some doctors still don't know that we're here. They have no idea. Or as being part of the committee when you submit your application to Fox Run, I read the medical records, the doctors think Fox Run is an assisted living facility, the entire organization. So they don't quite know what we have or what we do. I think when we started, we only provided physical therapy 3 days a week and OT 2 days a week. And we just had 2 staff members. So it has really grown, so they may not know that we have grown as much. But we try to communicate with physicians' offices a lot. If we can get past the secretary, the administrative assistants. But that is your right to go wherever you want. We certainly know orthopedic surgeons. They're a little bit of a fickle bunch. They like a particular therapist with certain things at a time. And if you develop that relationship, and it's good that they're like that because they know that their patient's going to get good care. But we have called orthopedic surgeons in that case and received their protocols and been able to take care of you and talked with them. So it's your choice.
But I was going to say, but that's the reason I am here, because that physical therapy is next door.
We're right here. You don't have to come outside, or if you're in the apartments.
But my doctor, for example, how do I get that across in that direction? Because as you just mentioned, he has his staff that,
Yeah.
okay.
Yeah, and that's
I need an answer to that.
So you can just tell them that it's provided here, and if they want to call me at any time,
okay.
I'm more than willing to speak with them and describe what services we do have.
Okay.
Yes.
I made an error once trying to get therapy, and certain therapists advertise about evaluations for back problems, and everybody has this problem or that problem, the other problem. Once you go and get that evaluation someplace, you're kind of stuck. And it's important that if you want to come here, you make sure the evaluation is done here. Otherwise, you may not be able to get that. And something you want to explain maybe.
So you have the right to go anywhere too. We have received patients that have come to us. So his question is, if you start somewhere else, you're kind of stuck there as opposed to coming here. You can stop there and you can switch over to us. there just has to be technicalities that that other facility has to stop billing before we start billing. Otherwise, Medicare notices that too, of course. I think I just spoke, podiatrists, we can't take prescriptions from podiatrists. We do, yeah, that's, we cannot do podiatrist prescription. Okay. All right. Thank you, everyone.
Okay, everyone, that does it for today's coffee hour. Tracy and Jessica are going to hang around for just a little while, so if you have questions, come on up and ask them. Have a great weekend, everybody. We'll see you next week.